Gentlemen, what if I told you that one of the most powerful ways to restore blood flow, improve sensitivity, and reignite performance wasn't in a prescription you'd have to refill every month, wasn't in an expensive clinic visit, but is already sitting on your own body right now? Yes, I'm talking about a spot about the size of a coin that when massaged for just 60 seconds a day could bring back what you thought was gone forever. And here's the best part. You don't need special equipment, no doctor appointments, and it takes less time than brushing your teeth. Sounds almost unbelievable, right? Maybe even a little awkward. But stay with me, because in the next few minutes, I'm going to show you exactly where that spot is, why it works, and how this simple massage could be the most powerful and natural boost you've been missing. But before we dive in, do me a quick favor. Hit that like button if you care about keeping your health strong after 50. Leave a comment and tell me where you're watching from. I love seeing men from all over the world supporting each other. And of course, subscribe so you don't miss future videos on men's health, vitality, and confidence. All right, let's talk about the truth behind this hidden spot. Most men believe that after 50, performance issues are just part of aging. They think blood flow slows down, testosterone drops, and intimacy simply becomes more difficult. So they either ignore it or reach for a little blue pill when things don't cooperate. But here's the truth. Age isn't the real enemy. The real problem is pelvic tension and poor circulation. Over years of sitting, stress, and inactivity, the muscles of your pelvic floor, the ones that control erections, urination, and even sensation, become tight and weak at the same time. Picture an old rubber band. It's stretched out, tight, but it's lost its snap. That's exactly what's happening in your body. Your blood vessels stiffen, nerves get compressed, and suddenly what used to happen naturally now requires effort or doesn't happen at all. But here's the good news. By releasing tension and stimulating circulation in the right spot, you can literally rewire this system. And the spot I'm talking about has been recognized for centuries in traditional medicine, but modern science is finally explaining why it works. For those of you who are new here, I'm Dr. Sophie Morgan, a board-certified urologist with over 10 years helping men in their 30s, 50s, and 70s regain vitality, confidence, and health without unnecessary drugs or procedures. I've seen firsthand how small natural interventions can bring back energy and intimacy men thought they had lost forever. And today I want to walk you through one of the most underused yet powerful techniques available, perineal massage, or what some traditions call the $1 million point. But before I teach you how to do it, let's talk about the 3 most common mistakes men make that block their potency, mistakes this massage helps reverse. Mistake number 3, ignoring pelvic floor tension. Most men don't realize their pelvic floor muscles are chronically clenched. Stress, long hours, sitting, even holding in urine, all of it makes those muscles lock up. What happens? Blood vessels compress, nerves dull, and circulation slows. This massage helps release that hidden tension, like unclogging a tight knot that's been strangling your performance. Biologically, you're decompressing arteries and nerves. Emotionally, you're releasing years of stored stress. Practically, 1 minute a day can restore what pills only mask. Mistake number 2, relying only on pills. Pills might help in the moment, but they don't fix the root problem. They force blood flow temporarily, but they don't restore flexibility in your vessels or strength in your nerves. That's why men find the effect wears off. This technique, on the other hand, retrains your body naturally, building real, lasting improvements. Think of pills as a crutch. This massage is physical therapy for your pelvic floor. Mistake number 1, believing age equals decline. The biggest mistake is giving up hope. I can't tell you how many men in their 60s and 70s I've treated who thought they were too old until we restored blood flow and sensitivity. Within weeks, their confidence and their intimacy was back. Your body is still capable. Decline is not destiny. It's a reversible signal. Now, let's get practical. Here's how you do it, step by step. Step 1, find the perineum. This is the area between your scrotum and anus. To locate it precisely, place your fingers about 2 to 3 centimeters back from the base of your scrotum, moving toward your anus. You're looking for a spot that feels slightly softer than the surrounding tissue. When you press on it, you should feel a mild tenderness or slight tension. That's how you know you're in the right place. This spot sits directly above your prostate and the network of nerves and blood vessels that control erections. If it feels tender when you apply pressure, don't worry. That tenderness means you've found the exact location where tension has been building. Step 2. Get into position. You can do this sitting on the edge of a chair, lying on your back with your knees bent, or even standing with one foot elevated on a stool. The goal is easy access without straining your wrist or hand. Find what's comfortable for you. Step 3. Apply the right pressure. Use your index and middle fingers. You have 2 options here. You can press down about 2 to 3 centimeters deep for internal stimulation, or you can massage externally for 60 to 90 seconds with lighter, circular pressure. The pressure should be firm but not painful. Think of pressing on a ripe avocado. You want to feel resistance, but you're not forcing anything. If it hurts, ease up. This isn't about aggression, it's about circulation. Step 4. The massage technique. You have options here. Small circles, 30 seconds clockwise, 30 seconds counterclockwise. Or a press and release rhythm, 5 seconds of firm pressure, then relax and repeat. Or gentle pulsing, up and down motions that feel like you're pumping blood into the area. All of these work. The key is consistency and rhythm. You're stimulating blood flow and waking up dormant nerves. Step 5. Use oil for maximum effect. This step is optional, but it dramatically increases the benefits. Castor oil penetrates deep, reduces inflammation, and improves circulation. Coconut oil is gentle, antibacterial, and supports hormone balance. Black seed oil, used in traditional medicine for centuries, is known for boosting testosterone. Warm the oil between your hands before applying. Cold oil on sensitive skin is unpleasant, and warmth itself improves blood flow. Step 6. Do this daily. Consistency is everything. 1 minute every day beats 10 minutes once a week. The best times are in the morning when testosterone is naturally highest, or in the evening to relax your body and improve nighttime and morning erections. Treat this like brushing your teeth. It's a daily habit that compounds over time. Now, I want to be very clear about safety. There are situations where you should not do this. If you have a fever or active infection, stop. If you're experiencing pain when you urinate or notice any bleeding, see a doctor before trying this. If you have hemorrhoids or anal fissures, wait until they heal. If you've had prostate cancer or have elevated PSA levels, consult your physician first. And if you're currently on antibiotics for a pelvic infection, wait until you've finished treatment. Your safety always comes first. For most men, here's the honest timeline. In the first 1 to 3 weeks, you'll notice relaxation in your pelvic area and reduced tension. Between weeks 4 and 6, about 40% of men see real improvement in erectile function. By weeks 8 to 12, results stabilize and can last 6 to 12 months. But consistency is key. Daily massage combined with pelvic floor exercises gives you the best results. Now let me take you back to Robert, the patient I mentioned at the start. When he came to me, he was defeated. He and his wife barely touched anymore. He felt invisible in his own marriage. He'd tried pills, but they only worked half the time. I taught him this exact massage, 1 minute a day, perineal pressure with castor oil, combined with Kegel exercises. For 2 weeks, nothing changed. He almost quit. But I told him, Robert, your body is relearning. Be patient. In week 4, he woke up with a full erection for the first time in 3 years. He called me that morning, Doctor, it's working. By week 8, he wasn't just functional, he felt alive again. His hip pain disappeared, his energy returned, he and his wife reconnected, not just physically, but emotionally. He told me later, I didn't just get my body back, I got my marriage back. Robert is proof that your body is still capable, that small, consistent actions create real change. So here's what I need you to remember. 1 minute a day, one simple spot. Consistency over intensity. Most men see real change between 4 and 8 weeks. Your body will respond in its own time if you stay consistent. If this gave you hope, hit that like button right now. Share this with someone who needs to hear it. Subscribe if you haven't already, because we're building a community of men who refuse to accept decline as destiny. And drop a comment below. Tell me, are you going to try this tonight? I read every single comment, and I want to hear from you. This is Dr. Sophie Morgan. Your body hasn't given up on you. Don't give up on it. Start today. 60 seconds, one spot. Everything can change.